Well, I actually came to join forces with all the agencies, government, international organizations, civil society organizations, and the media to be part of the awareness program that is going on around the country. As you very well know, it is quite a frightening disease, and the way it has been pictured out in the UK and elsewhere, it makes it even more frightening. But I thought that my presence here would help better. And don't also forget that I had written an open letter to His Excellency the President about this Ebola outbreak early in June. This was actually meant to bring attention to the virus. I have followed very keenly in the past about the Ebola virus, and when I heard about it in Sierra Leone, I thought it was a duty. I was due to band to inform the government and the international partners to take it very seriously and for us to put politics aside in our battle against the virus. That was early in June. And when it became apparent to me that the virus was now wreaking havoc around the country, I also decided that I should come home and join forces with everybody that is fighting against the virus.
Okay, upon your coming, your first call was to His Excellency the President. You paid a courtesy call to him. What was the thrust of your visit to him? What did you guys discuss?
We actually discussed Ebola. I told him I was here purposely for Ebola, and I was responding to his call for all Sierra Leoneans to join hands together and put politics and other considerations aside and fight the Ebola virus. So just a few days before I left London to come here, he had declared a state of emergency, public health emergency, and I thought that his office should be my first port of call to know exactly, to be briefed about what has been happening, and to inform him that I was here purposely to join hands with the government and other agencies to fight. He gave me a very good account of what the situation report, and after that I told him also that I am available to work within the framework of the health system or the sensitization programs going on at the moment, to add my voice, and because I believe that the element of denial has been very paramount in the spread, and I also believe that in as much as all of us are sensitizing, knowing the nature of our country, certain voices mean differently to different people around the country, and I know I have quite a lot of influence over certain people, and I thought that I should add my voice and be another messenger of the same standard message that has been delivered to people around the country.
There's been this talk around that Sierra Leoneans should forget about the blame game. But as a leader yourself, a politician, you've written a lot of press releases when this whole thing started. What do you think of it, especially with the way it was handled by our government?
Well, I am one of those who have advised us all to keep clear of any criticism at this point in time, not because we want to sweep anything under the carpet and forget about it. Definitely there are lessons to learn from what has happened, but at the moment that this disease is killing so many Sierra Leoneans at the moment, I thought that it would be in the interest of this country if we all paid all attention to stamping it out of the country. And then after that, we have what we call lessons learned. We will all come back and say, do a post-mortem of the whole incident, and then try to know who was careless, who did not do what they were supposed to do, or who did what wrongly, and why we have so many casualties from this outbreak. This is my own approach to this whole thing.
Do you think enough has been done so far by our government?
Well, there is more that we can do. There is more that the government can do in terms of helping to stop the spread. And I am personally urging the government to pay attention to not just the sensitization message, but also to providing the wherewithal that our health professionals need to be properly attired when they are tackling, dealing with patients that are Ebola related. Besides that, as a normal hygiene procedure, our medical staff, of course, should have the necessary precautionary equipment to deal with other diseases or ailments that are normal in every hospital. But at this point in time, I hope the government has brought in enough by this time, because by now we should not be talking about lack of gloves, lack of personal protective equipment, and all the other related paraphernalia needed to effectively combat the Ebola virus. It is quite a dangerous disease, and the equipment and the attire we need for our health professionals can prevent the spread, because the death of any medical officer, nurses or doctors, actually make it more frightening. Again, there is this element of fear, and fear itself is as contagious as the Ebola virus. If we allow many more medical staff to die, it is going to instill more fear, and that will definitely affect adversely our battle against the virus.
We've seen people making donations and even presenting checks to His Excellency the President. But as an individual, you decided to go on the ground. You were in Bo over the weekend, where you presented bags of rice and other supports to victims and their families and areas that are quarantined. Was it deliberate to target the direct beneficiaries?
Definitely, you are very correct. Before the spread of the Ebola virus to other parts of the country or around the world, Kenema and Kailan in particular have been referred to as the epicenter of this whole outbreak. It was in my intention to go to Kailan physically and Kenema and to talk to people, to add my voice to whatever message that has been given to people about the Ebola virus, and to tell them to know that it is rare, it kills, but it can be controlled. People have survived it, and that we should do everything possible as members of this country to make sure that it doesn't spread. So those were the two areas that I had actually targeted in terms of my intervention. And after consultations and reading some of the newspapers on getting on the ground here in Sierra Leone, I realized that one of the areas that needed, where there was a gap, was food. Just before I came, a lot of households and some communities have been quarantined, and not enough arrangement had been made to give these people food. I thought that going to as close as possible to these areas and making my token gesture of support and contribution to the Ebola effort, it will go reach the people very quickly. And it was also meant to call the attention of the government and everybody interested in the fight against Ebola that there was a need to support these people who have been confined so that they don't spread, and to tell them to at least pay attention. What I gave was actually just a token. 300 bags of rice is very small for the magnitude of the problem that we have on hand.
And these are all coming directly from you as an individual without the support of any other person?
These are direct donations from me.
One question that has been coming to mind is that you're a member of the Sierra Leone People's Party. Why didn't you use the already existing structures, like to do this as a party, so that Sierra Leoneans will know you're behind your party, and as a party you're ready to support His Excellency the President?
Well, I'm definitely a member of the Sierra Leone People's Party, a senior member of the Sierra Leone People's Party, and rightly so, I was the flag bearer. But we want to really, as much as possible, keep this away from politics. And as a senior citizen of this country, I think I have the right to intervene directly as a person. And I think I am honored to have served this country in different capacities at the highest level. And I feel that it is an honor and also a privilege. And therefore, I need to give back to society. And I didn't want to go through any other means rather than doing it directly myself as Maada.
Should Sierra Leoneans expect more? Because the case of infected people and death keeps increasing. Are there more plans to get more donation to quarantined areas or affected people in these epicenters?
I don't want to say Sierra Leoneans should expect more. I'm an individual, a retired military officer, and I have limited resources. But I think we ask the Sierra Leoneans pray for me as much as I can get. In the near future, I will definitely make more interventions that can have direct impact in terms of reduction or helping those communities that are in great need at this point in time.
Do you feel fulfilled, sir, as a Sierra Leonean, a very senior citizen, coming back home to join in the fight against this deadly virus?
As an ex-military person, it is always my duty to serve my nation. Once a soldier, always a soldier. And when the president called, I was already at a very advanced stage of preparation to come back home and make my own contribution. I know I'm limited in terms of technical knowledge to deal with Ebola, but I know that whatever little effort I make at this point in time will be highly appreciated, and I know it will help those in need and those that need support at this point in time. I've been doing a lot of talking around the country, taking a lot of interviews. But I think this is all meant to hammer home the message that other people have also been talking about, but from a different messenger, from a different person, so that people accept and acknowledge that there is Ebola. Ebola kills. It's been around for 40 years. It's been discovered for 40 years. But we can control it, and that people can survive it. And that we need to set aside or put aside some of our cultural practices in dealing with people. Now we don't shake hands when we meet. We don't hug. We have to safely dispose of anybody who has died as a result of Ebola, and those who have expert knowledge in disposing safely and in a dignified manner such bodies around the country. So that is the message I think I've brought, and I think there is also moral support at a time of need. When your country is in a stage of distress, I think it is always better to come back home. Indeed, it's very frightening when you are out there, because coming back, you are very few of you on the flight. People are not coming to Sierra Leone. Most of the airlines have suspended operations, and most other people we are not willing to come here at this point in time. But I have no other place to call home except Sierra Leone, and I thought it was a risk worth taking, and I will always take this sort of risk for my people.
Our president has openly condemned the international community for what he described as the slow pace in their support to this fight. Do you think the international community has not been that much supportive, like giving timely support? Well,
like I've said, I have not condemned neither the government nor the international community. As a matter of fact, I would have done that because as early as June, I actually called on the international community in the letter I wrote to the president and the president himself to put politics aside and bring all forces on board. And I also appealed, I'm making reference to this particular letter because I also appealed to the international community at that time about to come in immediately, knowing the nature of the Ebola virus. But nobody listened to what I was saying at that time. They gave deaf ears to my call.
Meaning our government as well as the international community should take the blame.
Not exactly. I think they should have acted at that time. But for me, like I've told you, we will come to blaming right quarters. We will come to I don't want us to be involved in the blame game at this point in time, frankly speaking, because it's going to distract us from fighting the main enemy, which is the Ebola virus. Some of us have to be blamed at the end of the day, but I want us to pay attention to fighting the virus. And when we are victorious in our fight against the Ebola virus, then, like we had the TRC, we will now come back to why we have lost so many people in this country.
So finally, sir, do you see us winning this fight with all the efforts, your own efforts as individual and that of the government and other people? Do you see us getting at a point where we'll win this fight so soon?
We can win this fight. We can only win it if we do it concertedly, putting politics aside, being very transparent. We should avoid corruption in trying to deal with this. Resources that have been allocated should be properly applied at all levels. Even at the lowest level, people should afford to apply as much as what is allocated for the fight to directly to the fight itself. And I think the international community, whatever blame we want to apportion to them now, we should wait until we are able to fight the virus. And I think they've started to come on board. Unfortunately, I'm not in that position insofar as knowing what has happened, what has been delivered, what has been promised, to say that we are far gone as far as the support for the fight against Ebola is concerned. So I will only say that from what has happened elsewhere, the DRC, Uganda and other places where there have been incidents of Ebola, yes, we can win this fight. We have to fight in a concerted manner, and we have to make sure that we are very clinical in our planning, so that what is meant for the Ebola fight against Ebola is injected at the point where it is needed.
Finally, any message to the BU supporters, members of the SLPP or Sierra Leoneans as a whole? What will be your message to them?
Well, I think it will be for Sierra Leoneans as a whole. My analogy is that the virus that has attacked us is just like the rebels that attacked Sierra Leone. The rebels came through Kailan, and this illness has started in Kailan, and it has made its way to the city and elsewhere in the country. We were able to combat that particular attack, the war, working with the international community, remaining as a nation united, and therefore I will appeal to all Sierra Leoneans to avoid the blame game at this point in time. The government has a blame. I have a blame. As a community, as a society, Sierra Leoneans have a blame. The international community have a blame. We will talk about that and deal with that and apportion correctly, but let's do it at a later time. What I want us to do now is to pay attention to dealing with the Ebola virus so that we can stamp it out. And I want us to give full support to our health professionals who are at the front line of this battle, just like we supported our soldiers who were at the front line of the rebel war. So that would be my simple advice. And to remind us all that Ebola is rare, Ebola kills, it can be controlled, and together we can stamp it out as quickly as possible.